Just recently, the minimum wage was approved, but unfortunately, till now, no doctor in Nigeria has started having the benefit of the new minimum wage of 70,000.
National Doctors' Day is a day set aside to recognize the contributions of physicians to individual lives and communities. The date varies from nation to nation depending on the event of commemoration used to mark the day. In Nigeria, doctors have often expressed their dissatisfaction towards the working conditions and their pay. Speaking with BTV News, Dr. Clement Ikponwe, senior consultant at Edo Specialist Hospital, stated the reasons many doctors in Nigeria are relocating abroad due to the poor working conditions for doctors here in Nigeria.
We know that the so-called Japa syndrome, a situation where doctors are migrating from Nigeria, moving to other greener pastures, other developed society, it's a challenge to the system, and it's been there and it's still there. And we as doctors have looked at the different issues affecting or causing this brain drain. What is attracting? What is the pull factor? What is making people to leave the system? One of the topmost thing is insecurity. The second major factor is economic factors. And so for it to be checked or checkmate, we need to address the issue of insecurity in the country. And secondly, we need to address the issue of economic challenges. The economic power of a doctor in Nigeria now has further been reduced. You find out that the average doctor now, he gets below $1,000 monthly. And that makes his purchasing power very, very poor. And that does not encourage the doctor, considering his years of training, his nature of job, nature of work, and comparing with other global standard, other doctors that have the same qualification in other clients outside this country. So when you look at your purchasing power, compare it to others, your classmates, and then what your power, what you can do at the end of the month is very minimal. You find out that you are struggling to make do with little that you have to, to take care of yourself, your family. It becomes a big challenge. So, and then when you look at what your colleagues are doing outside the country, what they are being paid, the facility they have, they are practicing instruments they use in practice, their place of work, how it looks decent, you want to also have that experience. So that is one of the major pull factors.
Dr. Clement Ikponwe also stated how doctors in Nigeria earn below $1,000 compared to their counterparts in developed countries, and also mentioned that the new minimum wage of 70,000 naira has not yet been paid to them. He appealed to the government to look into the situation to enable doctors earn more.
Following the introduction of the withdrawal of this fuel subsidy, the value of the naira as equivalent to the dollar today. If the government are really interested in preventing or stopping or reducing this Japa syndrome, this movement of doctors outside Nigeria to other countries, then the welfare of doctors must be considered, must be brought to the fore. Just recently, the minimum wage was approved, but unfortunately, till now, no doctor in Nigeria has started having the benefit of the new minimum wage of 70,000. No doctor is having that benefit. So doctors are still paid based on the previous minimum wage of 30,000, and that is not helping the system. That is not encouraging the doctors to stay. So the value of the naira has fallen, the fuel prices have gone up, and yet the minimum wage in actual sense today is still what it is. Sorry to say. So that doesn't encourage anybody to stay in the system. So it's going to make more people to pull out of the system. The delay in implementing the new minimum wage and the consequential adjustment for doctors based on their commerce scale is still an issue.
A well-compensated and motivated workforce of doctors can lead to better quality of care, improved patient outcomes, and a more efficient healthcare system overall. Balumi Mukoro reporting for BTV News.